What drew me to Rutland Regional in particular was the chance to have an outsized impact in someone's life, and Rutland was a place where I felt like I could really make a difference ultimately, and hopefully spend my whole career for several more decades of making sure that people can have expert care and making sure that they can have everything that they deserve. I would probably say, and I apologize that it sounds cheesy, but I would say my wife. And so my wife, I met her in middle school in Keene, New Hampshire, and she's been with me this whole time. Having her be a constant source with me through starting in New Hampshire and then traveling around to arriving here has been a great sort of anchor and a ground to something, to keeping me. And so I think having her there to help guide me has been really beneficial. I loved biology, so I went to Virginia Commonwealth University down in Richmond, Virginia, and I did the combined MD PhD program, which is twice as much med school, basically. So I was there for a total of 8 years. While I was there, I was informed that radiation oncology was a specialty. So we're one of the smallest specialties in medicine. So it's not something that people see most of the time, which is why I had never heard of it before. And so from the time in the lab and from doing my PhD in radiation oncology, I spent a lot of time in the clinic and then ultimately just decided to stay. When I'm not being a doctor, I continue to be the most king of the nerds you could possibly imagine. So outside of here, I spend a lot of time in my free time talking to my friends and colleagues across the country, across the world, in doing various things of podcasts and social media and message boards. And really, part of this for me, the draw of it is just by immersing myself in it, I find it genuinely rewarding, and I really wish that this was not the answer sometimes, but my hobby is radiation oncology. People here have more of a can-do attitude of just, whatever needs to get done gets done, and there's not a lot of, well, that's not my job, it's not my responsibility, that's someone else's. So it has really stood out to me, the fact that people here are willing to do whatever it takes to get somebody through what is usually the most difficult time in their lives. These days, it's important to remember that the diagnosis of cancer is not shutting a door. So I think a lot of people are worried about hearing that they have cancer and then being told there's nothing we can do. And that is never the case. There's always something that can be done. Now, it might not be what somebody thinks we can do or wants us to do, but there's never there's nothing we can do, or at least there shouldn't be in modern medicine. The one that resonates with me the most would be caring, because honestly, that's what gets me up in the morning every day. And so for me, no matter what happens during the day, or things good and bad, and this is a very difficult profession, as one would imagine, I can always know that I did what I could to care for another human being, that I used everything in my power and experience to be able to try to, if not cure, then provide symptom relief, and if not provide symptom relief, then at least be there and provide comfort. And that, of all the values, that one really, being caring, really resonates with me the most.